Welcome once again. This is the educational channel of Clexcel Eye Care Services, and we are continuing our talk on glaucoma. Last time we talked about some of the tests and procedures one is likely to go through should he or she need glaucoma care services. I am Dr. Richard Addai. I am an optometrist and work in the Middle East. And today I'll be discussing with you some of the management options available should you be diagnosed with glaucoma. So without much ado, let's get on right with it. Let's take it that you've been diagnosed with glaucoma. What is the way forward? First of all, bear in mind that in managing glaucoma, the target is to reduce the pressures within your eye, which is what we call the intraocular pressure, to a level that is not injurious to the optic nerve, if I should put it that way. So our aim is to reduce your pressure so that it comes to a safe level, that it doesn't cause any damage to the optic nerve. And in doing that, we employ different therapies. It could be medical therapy, sometimes we use laser, and then also when these therapies have failed, not necessarily failed, so, there is another option as surgical therapy. Each could be used individually, or a combination of these could be employed to get maximum result. So talking more on the medical therapy, what happens is there are different classes of medication that may be used, and the way these medications work are that they either reduce the production of fluid in the eye, or they improve the outflow of fluid in the eye. Remember that we said in one of our talks that as fluids are being produced, they have to exit the eye, else the buildup of these fluids will cause an increased pressure, which is going to cause damage. So in employing or making use of these medications to reduce the pressure, we are either reducing the production of fluid within the eye, or we are increasing the rate at which fluids exit the eye, so that the pressure will be maintained at a level that is safe for the eye. And like I've already said, there are various classes. Some of these medications reduce the production of fluid, and some of them to increase the outflow, and yet still some of them also combine these two principles to maximize the reduction of intraocular pressure. And these medications could be topical, and by topical I mean the eye drops that can be put on the eye, and sometimes they can be taken in orally, and then some of them too can be injected. When medical therapy has failed to give us the required pressures that we hope for, your doctor could also recommend laser therapies for you. And in these laser therapies, what happens is that laser is used to clear the trabecular meshwork. Trabecular meshwork is actually one of the drainage systems. There are two of them. The trabecular meshwork, which is in the anterior chamber angle, and then there is also another drainage system. We call it the uveoscleral outflow. These two work together to let fluid exit the eye, and thereby maintain or reduce or maintain the pressure within the eye. So what the laser therapy does is to burn off, or remove some of the clogs that may be in the anterior chamber angle, thereby allowing more fluid to get out of the eye, and then reducing the pressures. Okay. So when medical therapy has failed, or is not giving us the required pressures, and then laser therapy is also not giving us the required pressures that we need, we may now resort to the surgical therapy. There are different types of them. I don't want to go into much details about that. I'm just going to mention them. Surgical therapies may include what we call trabeculectomy therapies, where the surgeon makes some incisions, cut off some part of the trabecular meshwork to allow more fluids to get out in a process called trabeculectomy. And then sometimes too they may create a shunt, something like a gully, creating another pathway for the fluid to exit the eye. So there are various mechanisms, there are various surgical therapies that may be employed depending on your situation, all in the hope of reducing the pressures as much as possible. So recapping on today's discussion, glaucoma management can take the form of medical treatment, laser treatment, or surgical treatment, where in the medical treatment, various classes of medications could be used to reduce the pressure within the eye by improving the outflow of fluid or by decreasing the production of fluid. And then in the laser therapy, laser is used to remove some of the blockage within the trabecular meshwork, thereby allowing more fluid to get out. And then various surgical techniques, including trabeculectomy, and then what we call minimal incision glaucoma service mix. All these can be employed, either one of them or a combination of these techniques or therapies may be employed to bring down the pressures within your eye, thereby protecting the optic nerve from further damage. So folks, this is where time will permit me to bring today's discussion, and I hope to see you some other time. So until then, keep protecting your eye and then be safe. Thank you and bye bye.